24 million adults in Africa are currently living with diabetes. So WHO rep in Ghana in 2022 said diabetes is going to swell to 129% by 2045. Okay, so this is the Lab Doctors channel. I entreat you to subscribe to this channel, like, share, comment, and please, you can also find us on Instagram, on Twitter, and then TikTok at the Lab Doctor. Diabetes is a condition or a disease which occurs when one's blood sugar or blood glucose is higher than normal. So, glucose is the main source of energy in the human body. So, if glucose is not regulated very well, it can cause a lot of complication in the human system. So when one take in carbohydrates or any other energy related food, it breaks down into glucose in the human system. So glucose is either used immediately or is stored in the liver and then muscled for later use. Excess glucose stored in the liver is called glycogen, and then it's regulated by insulin or glucagon, a hormone produced by pancreas in the human system. So pancreas secretes insulin into the bloodstream. This helps circulate the needed amount of glucose to the various cells in the body, tissues, and then organs. So diabetes sets in if there is a destruction of the pancreas, leading to insufficient insulin and then also insulin resistance. So insulin resistance is where the human cells does not respond normally or adequately to insulin. Let's take note that glucose cannot enter into the cells and then tissues of the body easily without the help of insulin. So when there is a pancreatic destruction, which leads to insufficient insulin or insulin resistance, glucose then builds up in the human blood, leading to high glucose level or high sugar level in the human blood, which we call or we term as hyperglycemia. And then when there is low glucose level too, we term it to be hypoglycemia. Both type 1 diabetes and then type 2 diabetes are called diabetes mellitus. And then they are characterized by chronically elevated blood glucose level or blood sugar level. So type 1 diabetes happens when pancreas does not produce insulin at all. So this type of diabetes is associated with genetics, environmental, and then immunological factors. And it happens mostly among juveniles, that is pediatric patients. Type 2 diabetes is where insulin is produced all right, but it is insufficient, and so cells does not or are not able to respond appropriately to the insufficient insulin produced. It is also associated with conditions such as obesity and also influenced by genetic factors. Let's also look at gestational diabetes. This is a type of diabetes that develops during pregnancy, and this is as a result of hormonal change or imbalance. Extra weight or obesity during pregnancy can also lead to gestational diabetes. So prediabetes is where one's blood glucose level or blood sugar level is a little elevated above the reference interval. So in this case, if care is not taken, you may develop diabetes. Let's generally look at signs and symptoms of diabetes. You always feel thirsty, urinating often, you lose a lot of weight, feeling so tired, you always experience blur vision, slow healing of wound, and ketone in your urine. So let's look at complications that diabetic patients are prone to. So one is heart diseases. You are prone to cardiovascular disease. You are prone to nerve damages. We have eye damage. You are prone to skin and then mouth, gum infections, dementia, and then depressions. So let's look at laboratory diagnosis of diabetes. We have first that is fasting blood sugar. It is done with blood, and just as the name suggests, fasting blood sugar. So we are not supposed to eat in the morning. So it can be checked from 8 up to 11. That is the right duration time you can check your fasting blood sugar. Okay. And then we have random blood sugar, just as its name also suggests. It can be checked at any time and then any day. So both of them have different reference range or reference interval. Urine routine examination is another test that is used to help diagnose diabetes. So in the urine routine examination, you find your glucose showing or being positive. Yes, so these are various ways and then means diabetes can be diagnosed in the laboratory. So let's look at prevention. How then do we prevent ourselves from getting diabetes? First, we should make sure we check our blood glucose or blood sugar level at least once a month. We should eat a lot of vegetables, a lot of leafy food, and then fruits. We shouldn't take in a lot of fat, a lot of calories. It is not good for our health. We should reduce our sugar intake. We should exercise a lot and then maintain a healthy weight. We should try as much as possible to avoid smoking tobacco. It's another way that can help us prevent diabetes. Please kindly subscribe to the Lab Doctors channel. Like, share, comment. You can also follow us on TikTok, on Instagram, and then Twitter at the Lab Doctor. We'll be very grateful and very much appreciative. Just as I always say, a healthy person is a wealthy person. So let's take our health very serious. So till we meet again, bye bye. Thank you very much.